The other thing you can do is also rinsing your mouth, flossing your mouth. There is something we call floss in dental practice. So it's good you use it. Even if you are brushing twice, you need it, because those flossing helps you to get rid of some debris in between your teeth. So it helps to remove all those particles that you left there after eating. And it is very necessary you rinse your mouth, especially when you take food. After eating, you rinse your mouth, you gargle with water. Then another thing we can also do, especially when we have this cavity, is when we have the dental caries, is restoring the tooth. It can be done in dental clinic. So something that you felt that is paining, you need to remove. Sometimes it's not necessary. It's because you did not go to the right source. It's not to be. Instead of you leaving it and allowing it to cause another thing, it's better you visit your clinic, visit your dentist, let them restore it for you. There are some materials that looks like teeth. Even when they restore it, nobody will know that you have caries there. People that even know that you have caries there, they will like, wow, how come your teeth is like this? Because looking at it, they may not even know the material from your teeth. So it is very necessary when we find out that there is hole, there is caries in our teeth, visit the dental clinic, let them refill it for you. Then the last thing I will try to talk about is scaling and polishing. Scaling and polishing. For the visit to the doctor twice in a year, the doctor will always refer you to the therapist. In the dental clinic, there are section that is called therapist. The dental therapist, they are the people in some private clinic. The doctors does that themselves, while some nurses, dental nurses, also do that. So if you go to any dental clinic, they will do a kind of watching for you that will remove the particles, the stains, the whatever that you felt, and you will be fine. Because on the teeth, there is this plug that form as much as you brush. When you brush your teeth, in short 3 minutes after brushing your teeth, plug starts forming. This plug is just like a kind of stain that will just stain, that will look as if, when you wake up sometime in the morning, especially if you are not used to brushing teeth at night, you see a kind of, and use your tongue to touch your teeth, you see a kind of rub, as if something that is like it's carton in color. It's milky sometimes. It looks like milk, as if your tongue is touching me. Those are what we call plug. So when you leave that for a while, if you don't brush your teeth, before you know, all those plug begin to calcify. When it calcifies, it's called calculus. So in that stage, it becomes stronger and attached to your teeth. So I think Yorubas used to call it corn. Yes, they call it corn, but in dentistry we call it calculus. So it can be removed. All those tartar can be removed from the teeth in dental clinic. So it is very necessary, as God have it in mind to be protecting and preserving our life. He also have our mouth in mind also. And I'm going to stop by saying that sometimes when God wants to deal with our enemy, I've mentioned it earlier on anyway, He use their teeth as a kind of weapon they use against us. And when God wants to fight for us also, He also use their teeth as a aspect of their lives that God breaks. When Jacob was blessing his children in Genesis chapter 49 or verse 12, when he was blessing his children, when it gets to Judas, it described Judas as a person that has a whiter than milk teeth. So you should see that God himself is interested on our oral cavity, is interested on our teeth, interested on everything concerning our life. So please, as Christians, let's endeavor, as we are getting this awareness that we need to take care of our body. We need to, because God is concerned about our body, and most especially according to our teaching tonight, God is interested on our mouths.
Many reasons, sometimes people aren't able to maintain the recommended frequency of dental checkups. Oftentimes, when an extended time has gone in between cleanings, a more advanced cleaning may be recommended by your doctor. Harmful bacteria and hard tartar deposits called calculus build up on your teeth above and below the gum line, releasing toxins that cause gum disease, also known as periodontitis. Unfortunately, this buildup occurs in areas that can't be taken care of by brushing, flossing, or even a regular dental cleaning. Over time, as periodontitis progresses, it can lead to increased inflammation, bleeding, receding gums, and ultimately receding bone tissue. Your doctor can recommend a procedure called scaling and root planing to remove these deposits from your teeth. Scaling and root planing is a specialized procedure that removes excessive calculus and bacterial deposits beneath the gum line and is usually performed with a hand scaler and an ultrasonic cleaner, which uses high-frequency vibration to separate the calculus from the tooth. This procedure is for advanced periodontitis cases, and in many cases is so extensive that it must be done in stages. It may require multiple appointments to complete in order to ensure you are as comfortable as possible during the procedure. By removing the deposits and bacteria, this procedure is in many cases able to halt the spread of periodontitis. Your doctor will help you determine the next steps for continued rehabilitation of your gum tissue. However, if these symptoms are not treated appropriately, the progression can advance to a point of tooth and bone loss requiring costly and painful reconstructive dentistry to treat.
If this message has blessed you, please like, comment, share, and subscribe to this channel for more spiritual content. God bless you.